Welcome back, everyone. Orangeburg County ranks 8th in the nation for Alzheimer's prevalence. Now, local first responders are getting hands-on training in dementia in the care, which is an effort spearheaded by gerontologist Dr. Macie P. Smith.
And joining us today is Dr. Macie, along with Chief Deputy Chandra McPherson Gibbs from the Orangeburg County Sheriff's Office. Ladies, thank you both so much for being here.
Thank you for having us.
You know, Dr. Macie, you have, girl, been preaching about this subject, right?
Yes.
And when you told us about this partnership, and my goodness, what forward thinking for the Sheriff's Department to be willing to take this on. But what a critical partnership to be able to expand the resources and understanding and care for these families that are dealing with such tough situations.
Sure. At some point, we have to move from information-based to action-based. And the fact that Orangeburg ranks 8th in the nation, my goal is always, so what are we doing about it? And so being able to partner with entities like the Orangeburg Sheriff's Department, who are boots on the ground, oftentimes first line of defense, and coupling that with the Orangeburg Senior Helping Center, who is a resource for families living with dementia, it was very seamless. And I didn't have to do too much convincing when I walked right in there.
Not at all.
To say, hey, this is national news.
Right.
What are we doing? We don't want people to look at Orangeburg County and just say, bless their hearts.
Right.
They're 8th in the country. Not here, not today. When basic information and tangible resource, when they couple together, it should be synergy. Right? To be able to say, hey, this is what we're doing and this is what we expect, and what we can do is reduce the prevalence in the county with these tangible resources.
I love it.
And Chief Deputy Gibbs, you're so immersed in Orangeburg, not just as the Chief Deputy there in the county, but just as a person who's in that community. And so you see these stories firsthand and probably have had to respond to some of the calls where dementia plays a factor. How is this training going to help move your department forward with these responses?
Well, just like Dr. Macie said, the aspect of education, awareness, and then tools. You have the resources, because being that first responder, they're coming out and they're able, with the knowledge that she's given, and that was in one of the most energetic and engaging trainings I think that our guys have been in, but being able to make it where it's tangible information along with providing them tangible resource with the PACE Center and with what she shared, that we can also empower the families, because there's a level of helplessness when you get out there and you're working with the families because they're scared because their loved one has wandered off. And so now having this information and the training, and it's an educated training, not a guess, then it helps us to be able to serve with compassion as well as with resource.
And Dr. Macie, I have a question for you about the taking resources to the people. But first, Chief Deputy, I just wonder the proactive nature of this, right? Instead of just always being reactive after a tragedy has happened. How was that received by your deputies?
That was, we had to tell them, hey, there is another session.
Really?
Basically.
That's great.
Because they were answering, they were asking, they were coming up with strategies. And so there was real-time strategy sessions yesterday that we had in one of our sessions, where they were able to say, well, how does this work? How can I apply what you've taught me? And they were giving real life scenarios. And so it was well received, and it was, okay, Chief, so what else are we doing?
Oh,
you know?
I love it.
And I think one of the things is that it's a buy-in, and it's a buy-in not only from just the deputies, but from our sheriff.
Yes.
Our sheriff was in the training. And so Sheriff Ravenel is like, hey, we're not just gonna serve our community on the enforcement side, but let there be that proactive care, that proactive compassion, so that when our community members ask us for help, we're able to give them something and also have a lifeline.
Absolutely.
You know?
And that's what I wanted to talk to you about, Dr. Macie, being such a lifeline, because, you know, people will say, well, we have this in Columbia, or we have this in the upstate, but what good is that for people who live in Orangeburg County? You can't always expect them to be able to go to the resources. You need to take the help to them.
Exactly, and especially with our community. Let me just say that Black Americans are twice as likely to develop Alzheimer's disease than any other comparable group, but least likely to have the resources and least likely to be treated. And so those numbers and that data doesn't rest well on my heart, on her heart, on anybody's heart. And so even within particular cities, they're still silos. We're over here doing this, we're over here doing that. So this is really the tipping point here. We are going to have roundtable discussions, bringing in other partners, the public safety, MUSC Health, and bringing wraparound services around the family, because this is a disease that's still a lot of stigma, especially in the Black community. So they're not talking about it. And when you don't talk about it, then you don't ask for help and you don't receive support. So we're not going to wait for them to come to us.
Yeah.
We're taking it to the people.
And being on the topic of being proactive, I have to say, just past the dementia resources and care, specifically for seniors, the Orangeburg County Sheriff's Office has been doing an amazing program called Are You Okay?
Yeah.
Tell us more about that program and how people in the area can sign up for it.
Well, the Are You OK program is designed to do check-ins, and that check-in is for your senior citizens to literally just call them up. You sign up, you about 803-531-4647. I want to get my family member on, and it is specifically for our seniors, where we're able to check in with them. And how are you doing? Are you okay? Especially with the heat that that we experience here in South Carolina. What services do you need? Because you may have a loved one that's here, but their children or their close relatives may live somewhere else. And so just being able to know that this is, and if it is something that they're telling us, we've had situations where they've actually fallen, and we've had to send deputies over there to do welfare checks because, hey, they normally answer this phone at 10 o'clock and they're not answering.
Yeah.
So we need to go ahead and check on them. And it's just another way to reach out and connect. A lot of times with some of the community members that sometimes seem to be forgotten.
Yeah.
Yeah.
And I want you to repeat that number again. That's such a valuable program.
Yes, ma'am. It's 803-531-4647.
Okay. All right. Sounds good.
Ladies, thank you so much. And Dr. Macie, I know you're on all the social media platforms. Orangeburg setting the pace, setting the tone, but if other departments are interested in reaching out and using this kind of as a template to be able to do the same type of training in their area, we want them to be able to connect with you.
Sure, yeah. They can reach me at 803-814-6721.
Fantastic. We got it on the screen. Ladies, thank you for the great work that you're doing on behalf of the entire community. Thank you.
Thank you.
Thank you so much. We're going to take a quick break, and we'll make sure to have this interview online at wistv.com. More news and weather after this.